Hi and good morning for the Carbon Literacy Project Healthcare Day on today, the 8th of November. We'll just wait another 30 seconds or so to we'll just wait for some more attendees and then we will start. It's obviously a very exciting day today, being the beginning of the second week of COP26. Some very interesting discussions and debates last week, and we only expect to add to them this week. So this session is being recorded today and will be made available online shortly in an hour or two's time. So my name is Matt Sawyer. Welcome today. I'm a GP in the northeast of England. And I also run a sustainability consultancy and deliver carbon literacy training to healthcare staff and organisations. The structure of the day I'll run through in just a moment and introduce some of the colleagues from the Carbon Literacy Project. If people have any questions at any point, please feel free to use the chat. There will be a Q&A session at the end of the day, but at the end of each session as well. So welcome to everybody for the Healthcare and NHS Action Day. This session from 10 AM until 11 AM, we will be having a look at what free training tools are available to engage the NHS staff on the road to meeting the ambition of net zero. We're going to highlight some of those training materials that people can use to deliver carbon literacy training within your trust to help bridge that gap between the NHS Net Zero policy and the staff engagement. At 11:30 until 12:30, we're going to be speaking to some of the trainers and some of the learners who've already done some of the NHS Toolkit training, have a speak about some of the NHS trusts and how they've been managing to deliver the carbon literacy training already. At lunchtime between 1 and 1:30, we will have a session on what role does staff education and engagement have in meeting NHS net zero targets and how can we get there. And this will be an open panel discussion where we can hear from sector professionals about what they think in terms of educating staff and on why this is necessary to meet the net zero and the carbon ambitions. And then this afternoon from 2 until 3, we're going to see some of the engagement games and some of the tools that we use throughout the training. So how can carbon literacy training engage our learners? And then from 3:30 onwards, there's going to be a question time, and this is your opportunity to speak to carbon literacy project staff and myself about how we can get the ball rolling across our various trusts. So I'm going to tell you a little bit about myself and my journey, and then I'm going to hand over. So as I say, I'm a GP, and a number of years ago really realised that planetary health and the natural world was really absolutely essential to providing good healthcare and good population health. And as part of that, really some of the education that we've needed to do in terms of carbon literacy has been absolutely vital. So I spoke to Phil, who we'll be hearing from in a moment, and helped put together the first carbon literacy training course for healthcare professionals or for primary care staff. So being a GP and working in primary care, I was really thinking about how can we get these messages across to colleagues. And really, this has been a great journey for me because as part of that, or not as part of my personal journey, was the Greener NHS came along in October 2020 and set net zero carbon emission targets for the whole of the NHS. So this actually then fed into the narrative that this was something that was really, really, really important to be doing, and that healthcare staff, whether it be clinical or non-clinical, play a huge role in helping us to get there. So from my point of view, it has been fantastic to actually start to see more and more people and places and trusts, GP practices take this training on board and start to spread the word within their organisation. I'm going to be here throughout the day, but for now, I'm going to introduce Phil Corbell and Natalia Phipps from the Carbon Literacy Project, who will talk you through all of the some of the free training tools that are available to help engage the NHS staff on the road to meeting our net zero ambition. So if I could hand over to Phil at this point, that would be fantastic. Morning, Phil.
Good morning, Matt. Nice to see you. Thanks everyone for joining us. Before I start my bit, Matt's way too modest. He's trailblazed here out of conviction. I wonder if there are as many practicing clinicians and qualified environment manager type people out there. He's one of a very small number and deserves great credit for that. So as you'll get to know during the day, he's mixing his expertise with a great passion for getting this going across the sector. So thanks so much for your work generally, Matt, but also for helping out today. What we're going to do for the rest of the session, I'm going to lay out the generalities of carbon literacy, who we are, what we're intending generally. Then my colleague Natalia is going to say more about what's available in terms of resources for the healthcare sector. So if you know about carbon literacy, generally you might have heard this before, for which apologies. But otherwise, this is really our foundation. And now there's that small hiatus while I attempt to share my screen, and we'll take it from there. Good, excellent. I'm making the presumption that this is showing. So that's us. And this is hopefully what I'm talking about. But now, of course, we get that thing where this slide, oh yes, the slide does move on eventually in its own sweet time. Great, this is what I'm talking about. That's who I am. And that's our Twitter handle. Should you so choose to comment about this. There's a meme. I'd really like to know where this meme came from, but it's about why people don't act on climate change. They feel this. It's not me, it's not us, it's not here, it's not now. All of those are major barriers, of course, and we know that it's all of the above. It is here and it is now. It's affecting us. Something that exemplified that for me, we don't train, okay? But when this guy asks you to do some training, I should say we don't train, we do everything else but train. But we did do a bit of training for the King of the North, Andy Burnham, the Greater Manchester Mayor. And we did this around his first Green Summit in 2018, in fact. And one of the trainees was the Chief Constable. And I remember going around at the beginning of this session and saying, well, what happens to your job, particularly to Ian, the then Chief Constable, what happens to your job when it gets hotter? And he said, well, it gets, yeah, we arrest more people. Yeah, we arrest more people for violence and theft. And I said, yeah? He said, yeah. I said, well, that sounds like banter to me, canteen room banter. He said, no, we've got the data. And I said, if we've got the data, at what temperature do you start to see arrests increasing for violence and theft? And he said that. And the whole room sort of went, ooh, uh-huh. And the whole room sort of got it, that it was their job. This was a room full of public sector bosses, including health people. The current disruption from increased extreme weather is something that we sort of know about. You know, one picture from last year, and again, as health folk, I really don't need to tell you about the health ramifications for an event like this. Obviously, the call on accident and emergency, but then those long-term impacts on well-being, disruption, etc., etc. Again, we don't have time to delve into this, but this is well documented about those sorts of impacts. So again, to be really, really basic, and apologies for this, more extreme weather is more conflict, more inequality, and more ill health. And really, if people are resisting your work, our work on embedding climate action into healthcare, this, I think, is axiomatic. It's common sense. It doesn't matter where you come from. That sort of says everything you need to know to get on board with this. There's a recent favorite example of how mainstream this has got. I'm going to show you this graphic, and I want you to think who, if you don't recognize it, who would have made this graphic, and it's the front piece of a very wide-ranging climate and sustainability strategy. But what do you think of who would have had something so blunt? Climate change threatens peace. I think it's rather wonderful in its plain speaking. Even more wonderful, as it were, that it comes from the Ministry of Defence. And it is an extraordinary document in terms of its wide-reaching, we've got to put climate into everything we do type approach. So if the MOD are saying this, you know, ... So yeah, why do we bother about training? Again, I'm doing speaking the obvious bit. I'm sorry, but yeah, you don't send untrained staff to tackle an emergency. Are you going to put untrained staff into a room like this? We are facing an emergency. It's relatively simple. So we got to get trained up. So other reasons to get trained. We have to refer to the pandemic in the way it has exposed our fragility as a society to natural phenomena. And again, I can't quite remember who said this, but yeah, we're learning the hard way how to cope or not cope with large-scale naturally caused disruption. And again, I can't quite remember who said that. So as a wake-up call, yep, that's absolutely true. And then also on this front, in almost every aspect of society, climate performance and footprints, targets, action plans are becoming just mainstream. It's simply part of how performance is measured. And again, really, we can have the best plans in the world, but if we don't have people behind that plan, even in my discussions with the MOD, you know, command and control structure, which some of you will be used to in the health service, you need motivated people implementing a plan. Yep. Yeah, sure, you can tweak your thermostats, you can insulate, etc. You can switch to renewables, but again, who's going to implement this? Who's going to be motivated to implement this in the best way possible? It's fairly self-explanatory. And they don't just implement better, they innovate. And part of carbon literacy is to enable people to innovate within the workplace. And this is what we try to achieve with carbon literacy. Everyone has a contribution. How do they know what is the optimal thing that they can do to maximize their impact? So, quick diversion. Who are we? We are a registered social enterprise. That's what we do. But having invented carbon literacy, as I'll demonstrate in a minute, we gave the intellectual property to the Carbon Literacy Trust. And they have that intellectual property. They now commission us to work on their behalf. And as I said before, we do everything but the training. We introduce people to carbon literacy, and then we mentor course creation and getting the resources behind the training, and then do quality control through certification. Everything but the training. Where did we start? Well, yep, we started way back. We were involved in Manchester's first climate action plan, and we realized that there's this engagement gap. We have the technology, to use the phrase, we have the policies, but certainly back then there was a massive engagement gap. I'd venture there still is in a meaningful way, but it was almost like we were looking at the supply for a project and ignoring the demand. And I piped up and went, well, we need Manchester to be carbon literate. It became the big audacious goal. of that. And that's where we started. Not alone, we worked with a superb working group of employers, academics, campaigners to create what we've got now. We've created the carbon literacy standard, which I'll explain in a minute. We've got piloting, and now, yeah, we're getting into some serious numbers into the scale and rollout of what we're doing now. So what's different? What's distinguishing factors about carbon literacy? Yeah, I think so much, as an environmentalist, I think we might have been guilty of asking people to come and embrace us, be like us as environmentalists. I think it's vital to take the crisis to where people already are. So we, at the heart of what we do, we frame it. We always frame the climate message and the solutions around people's existing values and priorities. If you don't do that, why should people be bothered? If people were motivated to act at the speed and scale that we need, in reaction to another fantastic nature documentary and another picture of a starving polar bear on a melting ice cap, we'd be there already. So we have to frame the climate message around people's existing priorities and values. You'll be asking yourself this question: what is carbon literacy? This is the definition: an awareness of the carbon costs and impacts of everyday activities and the ability and motivation to reduce emissions on an individual, community and organizational basis. Yes, you can read. Let me pull out some of those things. So awareness, yes, you have to land the facts of climate change, and you have to give people tools, but you've got to glue that all together and motivate people as well. So awareness, ability and motivation, those are absolutely crucial to what we do. People talk a lot about green jobs, yeah, and they talk about new sectors, etc., all of this, but actually, you know what? This impinges on every aspect of working life, on the way we live. So actually, when we're talking about green jobs, we really mean all jobs. And as an example of that, this is just a snapshot of the range of employers that we work with. Not all of them, in fact, hardly any of them would be normally associated with climate action. The construction folk, Morgan Sindall, have embedded carbon literacy in their low carbon offer, into their social value offer. In fact, that's really interesting what they're doing there. We're working with them to create a sector-wide toolkit, more of which in a minute. One of my personal favorites, these guys scrap cars, or rather, they take the bits of scrap cars that still work and sell them. Brilliant piece of circular economy. On our Carbon Literacy Action Day last Monday, they ran no fewer than 5 courses, one of them just on their industrial estate where one of their bases is in Cheshire. And they just said, hey, neighbours, come and see what this is about. So they're a great example of, again, perhaps a slightly less usual company that's training its people and going great guns on this. Essential ingredients of carbon literacy then. Okay, it's a day's worth of learning. How you shape it, that's up to you. So a day's worth. Social learning, that's the jargon for keeping it relevant. Relevant all the time, consistently, beginning, middle and end. This is this bit about taking it to where people already are. We insist on the maximizing of peer-to-peer delivery. It's a trust thing, it really is. All respect to consultants and everyone, brilliant people providing external training into organizations, but if it's of your own people, of your own sector, that's really, really important. And there is the carbon literacy standard, which anyone involved in carbon literacy will get to know. That lays out the key ingredients, and we guide you through that. And the key parts of it, the learning outcomes, this stuff, fairly much expected. I particularly like the communication learning outcome, the ability and motivation to communicate climate to a wide range of people. That's a key part of this. Learning method, as I've mentioned, as well as relevance and peer-to-peer delivery, it's collaborative. We insist on a high degree of collaborative inquiry within the delivery of carbon literacy. And in terms of values as well, you know, you can have bad solutions to climate. No, we look at equitable solutions to the climate crisis and the positive contribution of action towards that. And then everyone that goes through carbon literacy ends their training by devising actions, the most significant actions that they can do, vast majority in the workplace, for an individual and a group. And in describing that significance, that's the evidence that comes back to us, and we issue certificates to learners for that. There's a process that many organizations go through to get accredited, and we can guide you through the detail of that infographic. This is us in numbers as of last week or the week before, I think. We've clocked up 23,000 certified individuals. I'll let you graze that, that blur of numbers. There's a lot in there, but draw your attention to the thing at the bottom right. That is an estimate given to us by Jacobs Engineering, the multinational. And while we are yet to be able to quantify, to have the resource to quantify the carbon savings from carbon literacy, this is their estimate based on projects they have managed and measured, and they've compared it against what they did with us. And they say that a program such as carbon literacy, if followed up appropriately with supportive measures in the workplace, in the average workplace, will save between 5 and 15% on its energy, which I feel quite happy about. This is what a motivated workforce can deliver, and from quite a good authoritative source. So that's us in numbers. And again, please ask questions if you want me to unpick some of that. We've gone down a route recently around creating shareable resources rather than asking each organization to create its own. This started with the public sector, and of course we are obliged to give a plug for the funders of that. It was actually a civil servant there who spotted, having got to know us, that, for example, one hospital course will be quite like another hospital course. So they thought having a shareable bank of training resources so that each hospital doesn't have to design its own thing would be a very good idea. And they commissioned us to work across the public sector, in central government, local government, blue light services, universities, and of course, the NHS. And these kits are basically what we're talking about now. We've also done this in the private sector. There's a automotive retail toolkit on its way, a construction toolkit on its way, and we're hopeful of a chemicals, these ones as well. And I can tell you more about that should you be interested, but it's happening, that same methodology is happening across the private sector too. So what are those outcomes? I think I mentioned a slight frustration at not yet having the budget to quantify the carbon dioxide equivalents, the greenhouse gas savings from carbon literacy. Yeah, attribution. That's the that's the thing that needs a bit of a budget to be able to attribute a saving to the training per se. So we've actually come down. This is really what it's about. It's culture shift. Yeah. At a micro level, and we've got data to show and research to show that motivation increases, confidence increases, and again, that ability and motivation to communicate and act. And coming back to this, how it optimizes the use of your skills and your position to make the biggest difference. And at a big level, people talk about individual change versus system change. Of course, it's not versus, it's and. And I think if our program can create this is a foundation for system change, speaking personally. We also have a carbon literate organization scheme that runs from bronze to silver to gold to platinum. And that is what people can put, it's the badge, it's the trophy, the email signature, etc. And again, we can tell you more about that. There's a way to get on board and we can guide you through this process as well. I hope that's fairly self-explanatory. It's a good way of motivating people and a little bit of healthy competition between organizations to get these goals as well. But that is a gallop through the generalities of what we do. Those are my contacts, but I say, please do ask questions as we go, either in Q&A or on chat. I'm going to stop sharing there and hugely slickly and professionally hand over to my colleague Natalia, who can tell you more about the materials for the healthcare sector. Thank you.
Hi everyone, I'm Natalia Phipps and I am Head of Sectoral Development for the Carbon Literacy Project. Before I get started today, I would just like to give a shout out to our healthcare coordinator, Louise Harling, who sadly couldn't be with us today. But yeah, I just wanted to give her a shout out. I feel like a lot of people on this webinar will have been in touch with her. Without her tireless work on this project, it wouldn't be where it is today. So I'm just going to run through a little bit of the actual why of the NHS needs carbon literacy very quickly, as Phil very thoroughly covered it as well. But in terms of why we really need carbon literacy for the healthcare sector, I just wanted to focus on a few key documents to give you a wider understanding of the importance of carbon literacy in healthcare. So the NHS released their Net Zero Strategy in October 2020, so around this time last year, and they focused on a few key themes that really came up around staff engagement and behaviour change. So they said that we really need to upskill our workforce. They need to be able to drive and implement the interventions outlined in this report. So it's not enough to just implement sustainability measures and put in new technology and schemes without people actually engaging in it and being motivated to want to engage with it. The staff will need to be able to learn, innovate and embed sustainable development into everyday actions within the healthcare sector. And also there's a massive importance of increasing the actual knowledge gap. So the words carbon literacy were actually mentioned within the report as being a really effective way of engaging staff within these measures that are going to be put in to deliver a net zero national health service. So in terms of training and guidance, all staff really need to understand the challenges faced due to climate change, and then also know how they can make a difference. It was noted that any influential changes to be spread and shared across the system, early engagement with the workforce was going to be essential, which was quoted in the report. This includes engagement over changes to how care is delivered. So for example, increased use of digital and tech and social prescribing, but as well changes to support services. So digital first approaches to communication, as well as facilities management. So that's things like recycling, use of green space, buildings, etc. Another report to really strengthen this, making the case for climate education, came from the Lancet Planetary Health body. So they released this report, which was a views national survey. And the article highlighted that despite being aware of climate change, healthcare staff felt uncomfortable discussing issues with patients and colleagues. And the report really highlights the need for continuing professional education, communication, training and patient educational materials. So this publication really points towards the insufficient knowledge of the links between climate and health for a lot of healthcare professionals, with 72% of them stating that professional climate education would be very helpful for them, and 65% stating that climate education materials would be very helpful for them. Just realised those are very similar. So moving on to the Toolkit Approach. So Phil mentioned this briefly, but I just wanted to go through it again, just so everyone was clear on how things work in terms of carbon literacy toolkits. So usually an organisation will come to us and say, we really want to roll out carbon literacy to our staff. And we'll say, great, and we'll send them a criteria checker form. And this is a list of 7 or 8 different criteria that need to be fulfilled for it to be considered a carbon literacy course. So instead of all NHS organisations and indeed the public sectors, which Phil mentioned earlier, going away, writing their own course and each trying to reinvent the wheel, which would take a lot of staff time and money, the government approached us to produce off-the-shelf toolkit courses so that they can be customized, so they're still relevant depending on locality, so where you are in the country, as well as organizational goals, which may differ, and also people might be at different stages in their carbon journey. But that there isn't so much work that needs to be done that everyone needs to go away and do all the research themselves. So the process that we went through for this was to go away and have a working group, of around 7 to 8 different organizations in each of these public sectors. They would sit down and discuss, okay, so what needs to be within our carbon literacy toolkit? What really needs to be covered? What policy is important? And what's really going to land well with the staff? Because we aren't the experts in any of these sectors. The people who work in the organizations are. So that's where the knowledge needs to come from. The outcomes of those working groups, we then distilled that information and created draft courses, so draft carbon literacy courses. These organizations, which then inputted into those pilot groups, went away, took those draft courses and ran pilots within their organizations. So they trialed the toolkits out with around 10 to 12 different people. And then we went through an evaluation process. So the trainers gave us feedback saying what worked, what didn't work. The learners told us what they liked and what they would have liked to see more of. And we took all of that information, redrafted the courses, went through another round of piloting them, and then we published the toolkits. So that's kind of where we're up to in terms of the NHS one. It's just being launched, and I'll let you know a little bit more about which courses are available in a minute. In local government, we have a leadership toolkit, we have a generic staff one, and we also have an elected members one. Within central government, we have a civil service toolkit. Within universities, we have a leadership one, which is launching, I think around this time of COP actually. We also have 2 existing courses which have been rolling over the last year with various universities all around the world. In blue light and emergency services, we have a fantastic ambulance toolkit as well, which is available. So when people ask, okay, this toolkit to train staff, is it really free? And we can say, yes, it is. So for all public sector organisations, and in this instance, NHS organisations, it is free to access, but only for the use of certified carbon literacy training. So when you fulfill your carbon literacy training, you have to pledge 2 work-based actions. So something you're going to do in your personal life to reduce your carbon footprint. And we try to encourage people to do this within their place of work to encourage that low carbon culture change that Phil mentioned earlier. It's great if everyone goes home and becomes vegetarian after the training, but if everyone is taking low carbon actions within their place of work, it's much more likely to cascade and move that organisation way further towards their net zero target. As well as your individual action, you also have to pledge a group action. So something you're going to do with your colleagues or your friends or your family to reduce the carbon footprint of that group as a whole. Those actions are then sent back to us at the project, and we certify your learners as either being carbon literate. Most of the time, the carbon literate, there's a very high pass rate because the quality of training is so good, or maybe we might ask them for a few more bits of information to check that they've understood the course. So that whole process, there's a £10 certification fee per learner, and that's the only cost that is associated with carbon literacy using these healthcare toolkits. All of the resources have been designed for distance delivery. So during lockdown, we adapted all of our toolkits so that they could be delivered via either Zoom or Microsoft Teams, depending on whichever platform you use. People are starting to do some training more in the room now, and you can use them for in the room delivery if that's something that you wish to do. And the toolkits contain all the resources you need for training delivery. So you'll receive a slide deck, you'll receive a detailed trainer manual walking you through the whole process, and you'll also receive with it some trainer tips and an activity PDF for those like engaging breakout room activities. So the whole process of designing these toolkits is really to make sure that a trainer feels very supported, and confident when delivering the materials. So, for example, a local authority toolkit that we launched this time last year, just before we were about to launch it, Winchester City Council came to us and said, we really want to, we're delivering training next week. We really want to use your new toolkit. Can we use it? We said, well, it's literally just finished. It's hot off the press. But if you want to use it, you can. And this was on the Friday. And they said, send it over. Our training's on the Thursday. If you run us through it, I'm sure we can do it. So we had a meeting with them on the Monday and walked them through it. They then delivered the training on the Thursday, and it went really, really well. And I think the phrase that was used is that the toolkits hold your hand at every part of the journey of delivering carbon literacy. Because carbon literacy isn't supposed to be delivered by experts. It's supposed to be delivered by people who are passionate about the subject matter and want to make that difference within their organisation. That's what people respond to the most. You don't have to be an expert in climate change to deliver this training. And the materials are really there to support you during that journey. So I just wanted to take this time to really thank all of the contributing organisations who have helped us to deliver these toolkits. Without them, we wouldn't have had this kind of level of expertise and help during this journey. So just wanted to say thank you to all of those ones on the screen. So in terms of what's available now for the NHS, this time, I think it was about 6 months ago, when we were first looking into all the different parts of the NHS. I think it was every new week there was a different part of the NHS which I found out existed. And Louise kept coming to me and said, oh, well, there's NHS improvement, there's NHS procurement, and some of them after a while they didn't even sound like they were real anymore. And I said, well, how are we going to create courses for all of these different parts of the NHS? We're going to have to, go through this process of piloting and so many times. So we decided to create a 75% of the course, which was generic. So this would be suitable for all NHS employees. So things like the climate science and a lot of the policy would remain the same. But there would be this 25% towards the end of the course, which would be sector specific. So whether you're in estates and facilities, procurement, whether you're frontline staff, say nurses or doctors, that part would be very specific to you and your working job role. And that would be the part which was adapted. So we'll have a look a bit more what that might look like. But in terms of what's available now, there's generic and leadership courses for NHS staff, and there's also an ambulance toolkit. In terms of customizable content, when I was mentioning earlier that it needs to be specific to your locality and your organisation, there's various parts of the course where there's these blue slides where you will adapt the slide depending on where you are situated or what's going on organisationally. So it means that you don't have to do like lots and lots and lots of changes, but it's still specific and relevant to your learners. So I'm just going to whiz through some of the slides now. And as we said, it's a day's worth of training. So this is really a whistle-stop tour, but it's just to give people a bit of an idea of what's included within the toolkit. So we always start with learning objectives. So by the end of your training, you will have gained an understanding of the basic science of climate change and how climate change is affecting us both globally and locally. Gained an understanding of how climate change is affecting the health service. Explored the low carbon objectives in your health service. So similarly to like the NHS Zero Carbon Report we looked at before. Created an action plan to help reduce your carbon footprint and the carbon footprint of your workplace. And also explored strategies for influencing others to take action on climate change. So this is all about communication and how to engage people and talk to people about climate change, which is famously one of the most difficult things to do. So this is the first module, which is looking at the climate science. So we asked people to watch David Attenborough's wonderful documentary, Climate Change: The Facts, as it displays the facts of climate change in a very visual and emotional way, which is also really important to make sure that the science lands well. And then it just has a bit of a basics of climate science recap and the climate change impacts. So this is what the slides look like. On the right, we've got Pathways to Our Future, which is looking at 2 different pathways that we could go down depending on what level of action we take. On the left, if we take latent or uncoordinated action, there's some examples of what might happen in terms of from 2050 to 2100 and beyond, what a 3-degree temperature rise might look like. Generally, this is a slide which really scares people, but it's really important that people understand the seriousness of the science and where we're heading. Whereas on the right, we paint this great picture of early effective action and saying that whilst there are some damages, they're comparatively small and no critical tipping points are exceeded. And then we also, on the left, look at greenhouse gases and which activities emit which greenhouse gases, so people get a strong grasp on that, as well as emission trajectories. In module 2, we look at climate change impacts on healthcare. So the impacts of climate change on our health, on our work, which groups are particularly vulnerable to climate change, and a bit about COVID-19 and climate change and the comparables between them. So how does this impact our work? On the left, so it's really making sure that people understand the link between climate and health. On the right, some examples of vulnerable communities and how they are disproportionately impacted as climate justice and the inequalities of climate change are really highlighted. And it's really important to make sure people understand those during carbon literacy training. And there's also quite a bit of focus on air pollution, as it's such a big climate issue, but also such a big health issue, and making those links. Module 3, we look at climate action as a health innovation. So co-benefits of taking action and kind of the whole prevention over cure theory. So on the right is an excerpt from our co-benefits game, where we look at lots of different low carbon actions, but think about what kind of impacts they have within the NHS and healthcare. So the kind of outcomes that we want to see within the NHS and climate are so interlinked. Things like better cardiovascular health, better mental health, community health, and also increasing NHS capacity, which a lot of that is thinking about things like funding and saving the NHS money. So things like plant-based diets, really good for the environment, but also really good for people's health. Things like encouraging people to walk and cycle to work, really good for the environment, very good for air quality. Also, reducing people's dependence on cars and local air pollution and all the issues it brings with it. So it's kind of bringing that whole climate action is also helping us to tackle social inequalities and linking those 2 together. Then module 4 looks at the policy position, so on an international, national and organisational level. So on the right, we have the NHS trajectory of emissions. So this blue line here is looking at historic emissions and where we're going. The top dotted line is our projection of if we do nothing between now and 2050. Whereas this bottom dotted line is kind of where we need to be on our net zero pathway. And on the right is all the different objectives and aims and things we can do in order to reach these 2050 goals. So it really helps people understand how we might meet these goals and go on this journey, because it can seem so overwhelming to think about the emissions reductions which are needed. So things like retrofitting buildings, low carbon inhalers and anaesthetics, and new models of care and preventative medicines. And on the left, it's just a few examples of further policy. So there's a blue slide bottom left, which is asking people to insert their organisational policy. Here we used Northwest Ambulance Service, who are an amazing organisation who helped us to create our ambulance toolkit, and just gives an example of their policies, but this is the place that you put in your own to make your staff aware of what's going on in your own organisation. Module 5 delves a bit further into carbon footprints, looks at the NHS's carbon footprint, as well as your organisation and trust's carbon footprint, and it's also got a footprint game. So the footprint game is on the bottom right, which asks people to look at their individual carbon footprint, which is also important for people to understand what's going on in their own lives. On the right, it looks at carbon hotspots. So this is a really important part of the course, making people realise that there's areas of the NHS which is disproportionately contributing to the NHS's carbon footprint, and where we really need to focus our action on. And on the left is the NHS footprint breakdown from 2020. Again, just delving into where does the carbon come from and how can we focus on those particular areas. Climate action in healthcare is the module 6. So looking at case studies of climate action in healthcare and what does a zero carbon healthcare sector look like. So it's really important for people to actually be able to see what kind of changes we need to make. But it's also important for them to be able to realize that they're not necessarily the pioneers on this journey, and that other people are doing things and we can replicate those models, see what's worked well. And these are some of, this section is really highlighting those examples and those case studies. For example, there's one here from Bart's Health Trust, reducing discharge times for from AAU, which I think is acute assessment units, but I don't work for the NHS, so I may be wrong on that one. So it's just giving lots of different examples of how the NHS can put in different interventions and the some data to go with it. On the right is a great activity, which is asking people to look at what a zero carbon healthcare sector might look like. So it's really important for people to actually be able to visualize the changes that we need to make within the NHS and think about how the system currently runs versus how it should run, and any benefits that might come with it or barriers stopping it from happening. And finally, module 7 looks at action planning and talking about climate change. So the activity on the left is a day in the life of, so it asks people in breakout rooms to have a look at a day in the life of a healthcare member of staff within the NHS, and ask them to think about what are the biggest carbon hotspots in that given role, and what are the biggest opportunities to reduce emissions in that given role. And again, it's always thinking about what the co-benefits are, and then asking people to pitch the idea back to the group, Dragon's Den style. So maybe looking at like an ambulance worker, thinking about where are the big carbon hotspots and how can they address those. On the right is what carbon literacy is all about, pledging actions. So that is our action planning form. And again, just what I mentioned earlier about pledging your 2 actions at the end of the day. So that's why carbon literacy is unique. It's not just sustainability awareness training, it's asking people to use their knowledge and motivation that they've gained during. And that is it for the module breakdown. So I'm sorry that that was through it so quickly, but just got my eye on the clock. So we're just going to go through a little bit on how can you get this rolling in your organization. So if you've liked what you've seen today and you're thinking, okay, I want to take the next step, we would advise attending an open training course. So in order for people to roll out carbon literacy training, we would really encourage you to go and get trained yourself first. Become carbon literate, you can understand the journey that people go on, you can understand how the toolkit works, and then you'll be more confident in rolling out in your own organization. And one of my colleagues will post our events page in the chat that you can have a look to see what open training is going on. Now, as this is still quite a sector which is early on in its progress because of COVID has pushed everything back in comparison to some of the other public sectors which are currently rolling, there might not be loads of courses listed on the events page at the moment. We're hoping that this will definitely pick up in the new year, but if you can't see anything listed and you really want to go on a training, please get in touch with us directly. Email us healthcare@carbonliteracy.com and we'll have a chat with you and just talk about what training is coming up. So yeah, that was my second point. Meet with us for guidance. Every organisation is different. in terms of who you should train first, how you should go about organising a pilot. Even if you just want to learn a bit more about carbon literacy, that's what we're here for as an organisation, to support you on this journey and link you up with other practitioners who are rolling out carbon literacy. The third, if you feel very confident and I just want to get going, that's absolutely great. And that's what the toolkit is there for. So you can just request the materials from us. We will send them over to you and you can set up a pilot in your organisation. So what setting up a pilot might look like is gathering a group of about 10 to 12 people who are keen to get trained in carbon literacy. You can roll out the training, get everyone certified, see how it goes, and kind of use that as your test bedding of carbon literacy within your organisation. You can take those actions further then, run them up the flagpoles, show people how successful it was. With this scheme, it can seem like it's a bit time intensive to commit healthcare staff to a day's worth of training, but the proof is really in the pudding. From today, hopefully, if you attend some of our other events, you'll really see the impact that it's had across the NHS in the organisations who have delivered it. So we would really encourage you to just try and be brave, take that first step, deliver your first training, see how it goes. People's enthusiasms and actions that come out of it really helps to sell the concept, especially if you're trying to encourage leadership to really get involved. These are some resources to help you on this journey, which again, we will post into the chat. So the first is a buy-in document for healthcare. So we've kind of compiled a best of the best quotes, different snippets of carbon literacy and why you should do it in your organisation. If you're writing a proposal or something like that to try and get this process rolling, we would really encourage you to have a look on this webpage and specifically look at the buy-in document, because there's lots of great information which can help you in that process. The second is our LinkedIn Pioneers Network. This is our group for carbon literacy training practitioners. If you have ambitions to roll out the training and you want to speak to some other trainers and see what else is going on within this sphere, we would encourage you to join this group. Everyone's really friendly and always happy to help. So the link is there. And finally, just the NHS Net Zero blog to talk a little bit about why the NHS needs carbon literacy and what we have available, just summed up nicely. And lastly, these are just our contact details. But yeah, I think that's it for the kickoff event. Please feel free to put any Q&As in the chat and our team will answer them. As Matt said, we have a jam-packed schedule today, so we really hope that people can come along and actually listen to people within the NHS and hear what they have to say about the training. The next event is at 11:30, so please join us then. But thank you, everyone, and we hope that
Can I just summarise as well? I
Yes.
was just going to leap in and summarise and say thank you both very, very much for that opening session. And I can really testify that the resources and materials really are amazing. And they are really, really detailed, and it gives you everything that you need to know. We'll hear in the next session about some of the trainers and learners and how they've done it. Secondly, I think that I've certainly been contacted by everybody from sort of anaesthetists in ITU departments through to estates, through to clinical research, and this training really is for everyone in the NHS. In terms of examples of alternate pathways, there's the cataract surgery, which in the UK is 20 times more carbon intensive, 20 times worse than the same surgery elsewhere. And actually, elsewhere, it can get better outcomes, lower infection rates. So there really are alternatives that can mean better patient outcomes at a far, far, far reduced carbon emissions. And personally, from a primary care point of view, the pledges that have been made by the individual and group pledges that have been made in practices, some of the practices have gone much further, and rather than just saying, I'm going to do one action, they've actually put in a plan to reduce the carbon for the whole practice. And so it's multiple actions. So this is actually one domino that really gets people thinking. And actually, when we get a number of people from the same practice or from the same department, they've all got a slightly different idea, slightly different take on it. And it's because they all want to do something different, all with the same goal in mind, that this cross-pollination of ideas can really, really take off. and actually is absolutely multiplied.
What you're saying there, Matt, it's about bringing people's own existing skills to the fray, isn't it? And this is our whole line, that everyone's got resources to bring to tackling the climate crisis. It's unlocking that and getting people working together on it, isn't it?
Absolutely, absolutely. So I think that at 11:30 we will see how some of the NHS trusts have been delivering the carbon literacy already. So please come along and hear from both the trainers and the learners who've been using the NHS Toolkit training. And I think that we'll probably stop at that point and say thank you all very much for listening. Hopefully we've answered all of the Q&A in the chat. I think that Phil, you might want to answer the question. Somebody's asked, is this the same Zoom link for the next session? So actually what's going to happen is that when this session finishes, you'll go back to the lobby and then there'll be a button for join the next session that then sort of appears not greyed out anymore, whatever the opposite of greying out is, so that you can then join that. So I would suggest that people stretch their legs, do a little bit of exercise at home, jogging on the spot or something, or in the office, and have a cup of tea and a comfort break, and we'll see you back in about half an hour or so. Thank you all very, very much for being here.
Thank you, everyone.